Welcome to Medical Marijuana and Wellness. Tonight's topic is understanding cannabis as medicine. We're going to be talking about cannabinoids and the endocannabinoid system. This is a very important topic because cannabis has been used as medicine literally for over 5,000 years. And there's been journals written as long as 5,000 years ago by Chinese doctors on how to use cannabis for medicine. So it's an interesting topic. It's one that really we need as a country and as we need to understand, because cannabis has tremendous healing potential that can help a lot of people. I've been in this business for now 10 years, and I've seen it do wonderful things with a lot of people, especially people that have been given up or somehow been ignored by the pharma systems. So anyway, I don't want to get into stealing a lot of the thunder of what we're going to talk about tonight. I do want to mention that we do have a webinar series. Please feel free to tune in to some of the webinars coming up, like our edibles webinar next week. And I do want to say, if you have any medical condition that you need help with, please contact your medical marijuana doctor, your medical marijuana practitioner, and or your medical doctor for your help. Anyway, I'm going to jump into a video right now where we're going to talk about understanding cannabis as medicine. And then afterwards, we'll answer the questions that you brought up prior to the webinar, when you send them, when you registered, and also any questions you have during the webinar. And please feel free to hit that Q&A button and ask questions during the webinar. We're here to answer your questions and really demystify cannabis and help you get your life back. Welcome to Medical Marijuana and Wellness. Tonight's topic is cannabinoids and the endocannabinoid system in our Understanding Cannabis as Medicine series. Joining me today is Amy Green, an RN at MMTC of Florida. Amy, welcome.
Always wonderful to be here. Thank you, Mark.
It's always great to talk about cannabis, especially as medicine. First of all, as a follow-up to this webinar, you'll be getting an email that'll give you links to the recording, to the presentation, to the slides, and then any sponsor discounts that are there. And also during the presentation, feel free to hit the Q&A button. You can ask questions, which we'll answer at the end. And naturally, this webinar is for information purposes only. If you have any issues related to medical, please contact your doctor, medical marijuana doctor, or your medical marijuana practitioner. So Amy, let's jump into cannabis as medicine. What is cannabis? I mean, it's made up of a couple of different components.
Yeah, so when we think about the cannabis plant, what we're actually talking about is the different components that make it up. So there are three main ones. The first one is going to be cannabinoids. That's going to be the things we've heard of, like CBD and THC. And then we have terpenes, which are what give cannabis its smell and its taste, and also provide a lot of the medicinal benefits. And then we have flavonoids, which also contribute to the color, taste, and smell of the plant, and are also providing some of the helpful medicinal benefits as well.
And Amy, when we combine a number of these together, like we combine THC and CBD together, we get something called the entourage effect. In other words, they actually boost each other to be more medically effective.
Yeah, absolutely. So when we put them all together, we do end up with something called the entourage effect. And that is how those different compounds are working together in our body to provide the effects that we're looking for.
Now, the question becomes, what are cannabinoids? And I think that it's something that we're kind of learning about right now. But cannabinoids were actually founded in 1896 on a paper that was done in the Journal of Chemical Society. And it was interesting because at that point in time, they were looking at just CBN, which is one of the cannabinoids. As they started doing research into it in the 1940s, they actually found out that CBN had a structure and it actually had a chemical analysis. And this was done by a doctor named, British chemist named Robert Kahn. And in 1942, a chemist, again, named Dr. Roger Adams, discovered CBD. Now, this was during the war, so there wasn't a lot of research going on, but it's interesting how there was a lot of research going on. We did find out a lot about this, but it wasn't until 1960 when Dr. Raphael Mechoulam started studying cannabis, basically on a grant from the United States government. And he's the one who actually identified CBD and also THC, as known as the father of medical cannabis. He's the one who also defined the endocannabinoid system. But Amy, these cannabinoids and the endocannabinoid system are really important to our body staying in balance, or what we call homeostasis.
Yeah, so when we think about cannabinoids, they are the molecules that stimulate the cannabinoid receptors of the body and brain. And the cannabis plant actually naturally produces over 120 different cannabinoids, and THC and CBD are just two of those. And then big picture, we're thinking of the endocannabinoid system. So that is a naturally occurring system in all of our bodies, and our body produces cannabinoids, and that's the endo, the inside part that we're producing. In our body, the endocannabinoid system helps regulate various cognitive, physiological, and pathophysiological processes, including immune system activity, memory, mood, pain, and it also helps mediate the pharmacological effects of the cannabis plant.
Really interesting in that the endocannabinoid system parallels the nervous system that we have in our body. The real key is these endocannabinoids trigger our receptors. Tell me a little bit about that, because they're agonist, antagonist, or inverse agonists.
Yeah, so this is a little bit in depth, but what cannabis is actually doing in our body is it is allowing signals to travel through the endocannabinoid system and through the nervous system. And it does that in a couple of different ways. So one is as an agonist, which is a chemical that activates a receptor to produce a biological response. Cannabis can also act as an antagonist, which blocks the agonist response. And then you also have an inverse agonist, which is the opposite of the agonist response. It has a lot of different functions in the body, and this is kind of deep into it, but that's just basics of how it's working within our body.
We're not trying to make everybody doctors or chemists, but we do have them understand that these properties of cannabis actually stimulate the receptors in various ways that really lead to why it's acting as medicine. It's really helping our bodies. But
Absolutely.
the most important ones that we find out there are what we call the ones in the endocannabinoid system, which again is a system that parallels our nervous system. And this is where the CB1 and CB2 receptors come into play.
Yeah, so when we think of the CB1 receptor, these are receptors that are mostly located in the brain, the spinal cord, and in some peripheral organs and tissues. And these receptors act like gates that open and close to control the levels and activity of most of the other neurotransmitters in our body. And then there's also a second type of receptor that's called a CB2 receptor. This receptor is mostly found on white blood cells, the tonsils, and in the spleen. And this receptor helps control immune functioning within the body and the inflammation in the body as well.
And this is how your body basically balances itself or manages itself and stays in what we call homeostasis, or the ability to be able to stay in balance. Now, the next interesting part about CBD is it not only works on the endocannabinoid receptors, but also works on other receptors in our body.
It does, yeah. So CBD, the non-psychoactive cannabinoid from the cannabis plant, it does work with a lot of different receptors, including the 5-HT receptor, which is part of serotonin receptors, and responsible for digestion, blood flow, breathing. The A2A receptor, which is part of your inflammation and coronary circulation systems. The VR1 receptor, which is responsible for body temperature and pain response. And then the GRP55 receptor, which is responsible for blood pressure.
So essentially what's happening is cannabis is acting like a super vitamin for our body.
It is, yeah. It affects a lot more things in our body than I think we realize, and it's working on a lot of different levels. So THC is not just there to get you stoned, make you heady, make you drowsy. It is affecting a lot of different things and different processes within the body.
Now, what's interesting about cannabis is it's not just a property. In other words, when you look at how cannabis is made, when the flower is first coming out of the bud, it's in what they call CBG format, and it then sprouts into acidic forms, which is THCA, CBDA, and CBCA. But Amy, when that's heated or aged, that's when all the different cannabinoids get created.
Yeah, so CBG, sometimes called like the mother of all of the cannabinoids, because that is the first cannabinoid that appears in a very young cannabis plant. And then as that plant grows and matures, and as it's harvested and then dried or heated with fire, we get a lot of different cannabinoids through that process. So the CBGA, which is the acidic version, is morphing into THCA, CBDA, CBCA, and then as the plant matures, we get the THC, CBD, CBC. Some of those property changes, like going from the acidic form of THCA to the non-acidic form of THC, that's actually done by applying heat. So a lot of people consume cannabis by, rolling a joint or some device to light it on fire. And when they're actually applying the heat to the cannabis, they are doing that conversion from THCA, the acidic form, into the active form of THC, which is what we think of when we think of the help with inflammation, help with anxiety, a lot of different properties that we think of THC are actually coming from heating the THCA.
Yeah, and you can see the different medical properties that are here. This is hard to read. I know you'll be getting a copy of this in the follow-up, but there's a lot of different medical properties for each of these cannabinoids, and that's really the key that's really there. I did want to point out, just like in regular pharma medicine, in the cannabis world, we have a periodic table. And this is, although there are 120 cannabinoids that have been found, there's also over 120 different terpenes that are found. This is just a small portion of the cannabinoids, terpenes, and flavonoids that are out there. And it's interesting, Amy, each of these has different medical properties.
They do. Just like you said, all of them have a little bit different medical properties, and they also naturally occur in different quantities within the cannabis plant as well. So that's why you get a lot of the variety in the effects of one product to another, is all of these compounds are naturally occurring in the plant, but the final mix that we actually get as a consumer is a little bit different each time.
And by being able to mix the cannabinoids with the terpenes and the flavonoids, the product has different medical properties. That's why cannabis can address such a wide range of conditions, because what we're looking at is not a product, but really it's 120 different products mixed with 120 different terpenes, which give us a very big toolbox for being able to address people's medical conditions. Now, this is an example of some of the cannabinoids that are there. These are kind of the most popular ones that are there. You want to kind of cover these really quickly, because each of these has a property, but more importantly, each of them focuses on different parts of the body to be able to address a medical condition.
Yeah, absolutely. So I'm pretty sure most people have heard of CBD. That's generally considered to be the non-psychoactive part of the cannabis plant. CBD, even though it's not going to give psychoactive effects, is still a really, really strong and powerful cannabinoid, and it provides some excellent benefits, such as being an analgesic, anti-inflammatory. It may have anti-seizure and anti-anxiety properties, and it may also provide anti-tumor properties, and that can help with things like muscle spasticity or stress and anxiety. And then you have THC, which is the psychoactive part of the cannabis plant. A lot of people already know that it's a really good pain reliever. It's good for anti-inflammation. It's been shown to help with seizures. It's neuroprotective, and it's also a bronchodilator, amazingly enough. So THC specifically can help with things like nausea, muscle spasticity, insomnia, post-traumatic stress, and then stress and anxiety. When we're looking at something like THCA, again, the acidic form of THC, before we've applied any heat, that is still really beneficial. It does provide anti-inflammatory and neuroprotective benefits, and it can or may help with slowing the proliferation of cancer cells, the treatment of MS, Alzheimer's, and Parkinson's. We also have the other four would be what we would consider minor cannabinoids. They're the ones that you won't see in great quantity in the finished product, but they are, again, naturally occurring, and they still provide really helpful benefits. For example, the THCV, analgesic, which is a pain reliever, anti-inflammatory, anti-seizure. It's going to help with nausea. It may help with Parkinson's or reducing appetite. CBG, again, that's what we think of as like the mother of all of the cannabinoids. On its own, a really great analgesic, pain reliever, anti-inflammatory, neuroprotective, and it may help with things like psoriasis and other skin conditions. Then we have CBN, which is anti-inflammatory, neuroprotective, antibacterial. The really cool thing that I like about CBN is it actually has really sedating qualities, which on its own is a fantastic sleep aid. So it may help with improving overall sleep quality, and it can also help stimulate appetites in patients suffering from cachexia or anorexia nervosa. And then finally, we have CBC, which is antibiotic and neuroprotective, and it may delay the onset of Alzheimer's and other neurodegenerative conditions. It may help promoting neurogenesis, which is the making of new pathways within the brain, and it may help with regulating body temperature.
So these are just 7 of the 120 cannabinoids that are out there. And what I want to point out when we talk about cannabis as medicine, each of these has different medical properties. And by being able to work with your medical marijuana doctor to identify which cannabinoids you should be using, more importantly, getting them from the dispensary, what you're able to do is able to target a medical cannabis product for your particular condition. How we take these, there's really 4 different routes of administration. There's sublingual, oral, inhalation, and topical. These really break down into, when you look at it, a number of different ways you can take medical cannabis. These are called routes of administration, and they range anywhere from tinctures all the way down to transdermal patches. Tell me a little bit about them, because one of the nice parts about medical cannabis is you can have what they call a route of administration, or a way of using it that really suits you, what you're comfortable with. Whether you like smoking, don't like smoking, prefer tinctures, edibles, topicals, that type of thing.
Yeah, absolutely. So when a patient is considering what product they might want to use or might want to start with, there's always a lot of things that we want them to consider. The first is going to be the onset of the effects. So that's how long after they take the product they start to actually feel the effects. For example, with something like a tincture, the onset time can be as quick as 20 minutes, but can take up to an hour and a half to 2 hours to feel the full effects. Versus something like a vape or smokable flower, the onset time is almost immediate. Within 3 to 5 minutes, the patient would know the full effects of the dose that they're taking. Now, when we're considering something like the duration of the effect, we also have kind of the same dilemma. Consider again a tincture. Because it does have to go through the gut and be absorbed that way, we know the onset time is going to take a while, but generally the effects are going to last a lot longer than a product like a vape. We can usually expect results from like 4 to 8 hours for something like a tincture. Compared to a product like a vape or smokable flower, we would usually expect the duration of the effects to only be, 1 to 4 hours on the long end. So definitely think of how long the effects are actually going to work for you.
Like edibles and capsules, they could last up to 10 hours.
Absolutely. And so thinking about how long those effects are going to last is really helpful when considering how often you might have to take a dose to meet your own needs.
And there's kind of a rule in medical cannabis. The longer something takes to take effect, the longer the duration. So for example, if medical flower flower takes effect right away, it only lasts 2 to 4 hours, where something like capsules, which may take 30 minutes to 2 hours, can last anywhere from 4 to 10 hours.
Yeah, absolutely. And that also brings us to the ease of titration, which means how easy it is to adjust the dose to meet your needs. Again, for a product like a tincture, it's measuring the dose on the eyedropper that the tincture comes with. So you can get very exact dosing just going either drop by drop or using the measurements on the eyedropper. With a product like smokable flower or a vape, the dose is generally going to be titrated based on how long you're inhaling. And with a product like a vape, that can be pretty easy. You start inhaling, the vape turns on, you stop inhaling, the vape turns off. With smokable flower, it can be a little bit harder to titrate like that. A lot of people have a tendency with, especially a product like a pre-rolled joint, once it's lit, they kind of keep smoking it. So it can be a little bit harder to get titrated dose with something like smokable flower. We also have to consider the availability of the entourage effect. So that means, does the product contain cannabinoids, terpenes, and flavonoids? When we look at some products like edibles, it may just be THC isolate, so it's only THC in that product, and it may not contain the other entourage items, the terpenes and the flavonoids. When we compare that to something like a vape, that may have terpenes, flavonoids, and it may have a variety of cannabinoids in it. So you also have to think about what's contained in the product that you're using. And then finally, required items. That's going to be, say, for example, a patient purchases smokable flower. They have to do something with it. That can be rolling it into a joint. It can be putting it into a bong, but it does involve having to purchase something else to be able to use it. Versus an edible, you purchase the product and it's ready to use.
Right. And typically tinctures are the same way because they come with an eyedropper. Now, when we talk about smoking cannabis, it's important to pay attention to the temperature. In many cases, not only you can when you roll a joint and you light that joint with a 550-degree match, you're burning off a lot of the cannabinoids and also the terpenes. We'll talk about that in just a moment. But really, I recommend using what they call a dry herb vaporizer, which is a device that you put the cannabis into. And what it does is it steams the vapor rather than burning it, which gets rid of a lot of the bad things for your lungs, like a lot of the carcinogens, but also allows you to tune the temperature in, which allows you to dial in the concentrates and also the terpenes that you want.
Yeah, so when we consider a product like a vape or a dry herb vape, which is essentially turning smokable flower into a vape, we do have to consider what temperature we're using the product at. Generally, lower temperatures are going to provide more medicinal benefits, and higher temperatures tend to provide more, I would almost call them recreational benefits. Like it's more of a chance to have the psychoactive effects. It's more likely to have more intense effects. So considering temperature is also considering how you're using the product.
And when you purchase a vape pen, let's say from a dispensary, you get a low, medium, and high setting. You'll get like a blue, green, and red setting or something like that. That's what we're talking about here. Each of those settings triggers a different set of cannabinoids and different sets of terpenes. So when you have that, you buy that vaporizer from the dispensary and you have the different settings, you can be able to know what you're really dialing it in for your particular condition. And of course, if you buy a dry herb vaporizer, you can actually set the exact temperature itself. Like, for example, myself, I set mine at 356 degrees because I'm looking at targeting inflammation and pain, which is this category in here. So one of the questions that comes up, Amy, is how do I know if I have a medical cannabis product, what's in it?
Yeah, absolutely. So in the state of Florida, any product that's sold at a state licensed dispensary, they have to be able to provide a COA or certificate of analysis for any product that they sell. What this COA is going to provide you is specifically what is the route of administration. For example, with this product, it's an oral capsule. What type of product it is. So in this case, it's a sativa, which tends to be more uplifting, may give some patients a little energy boost. It's going to tell you the potency, or specifically what you can expect to be in that product and what they're guaranteeing is in that product. And then also, what are the other components of the product? So in this case, this product, this capsule, has terpenes in it, which is going to benefit the entourage effect. So asking to see a COA is going to tell you not only that you're getting the product that you're paying for, but specifically what's in the product and also what's not in the product. Because besides testing potency and for terpenes, they're also testing for things like contaminants, heavy metals, mycotoxins, any pesticides left over from the grow process. All of that is being tested for as well.
And that's really, really important to make sure that you have what they call a clean product. And I should point out in this particular case, this product has, this is a wellness product, which you get from Air dispensaries. This one also has it is a sativa RSO capsule, but it also has beta-caryophyllene in it, which is great for pain management. And that's one of the reasons why a lot of people use this, is it really helps with pain and also for inflammation. This is a very important document. So when you're purchasing medical cannabis products, ask your dispensary for this particular certificate of analysis. You'll know exactly which products you're getting, meaning the cannabinoids, terpenes, and also the flavonoids that are there. So we've covered a lot of topics. We've covered a lot of information about cannabis. I know that this is a lot of information in a very short amount of time. You'll be getting an email from us that has a link to a video of this webinar, so you can watch it again if you want to. And more importantly, you'll have a copy of a flipbook copy of this presentation, so you can take a look at any notes that are out there, for example, the temperature charts. Now, that being said, let's jump into some of the questions that were submitted prior to this webinar. So the first question is, how can I use cannabis to help with pain and inflammation from adhesive, and I don't know how to pronounce this, so I'm not going to try, but I do know what it is, okay? The answer to your question is pain and inflammation are probably one of the two main reasons that a lot of people use medical cannabis. I know it's the reason that I use medical cannabis. I have 7 herniated discs in my neck and have, again, need relief from the inflammation and also the pain. So how can you use it? Well, first of all, if you take a look at the terpene chart and you look at the terpenes that address both pain relieving and inflammation, here's a list of the terpenes that actually do this. Now, what's interesting is if you go in and you talk to your both your doctor, but more importantly your local dispensary, what you want to do is you want to mention to them you're looking for something that'll help you with pain and inflammation. But what you really should do is also tell them you're looking for something. A couple of the terpenes out of all of these that you're going to want to mention to them is you're looking for something with caryophyllene, myrcene, and then also you want to talk about them having limonene in it as well. Now you may or may not want to use pinene. Pinene is great for pain, but pinene also brings back some short-term memory. So if you suffer from PTS or have problems with PTS, you may want to avoid a product that has pinene in it. But I do want to point out that what you want to do is you want to look for, let's separate pain from inflammation if we can for a second. First of all, when you're looking at something like pain, what you want to do is you want to take a look at something like a 50-50, 1-to-1 THC to CBD combination. When you go into a dispensary, you'll hear about a 1-to-1 product. That is CBD first, one CBD to every 1 THC. And that helps really, it's one of the best products that you can use for pain and inflammation. Now, in my particular case, I'm really concentrating on inflammation, especially because I found that both with my neck and also because I have artificial knees, welcome to being a senior citizen. What happens is that what you want to do is you want to really concentrate on inflammation, because if you reduce the inflammation, it will reduce the pain. And so in this particular case, I'll use a higher concentration of CBD to THC. I may use a 2-to-1, may use a 4-to-1, may go as high as 9-to-1, depending on the day and what I'm trying to accomplish. And those are ratios that when you go to the dispensary, you can ask them for a ratio product, again, like a 1-to-1, 2-to-1, 4-to-1, and that's CBD to THC. Or if you're looking at managing pain, which is the other side of the equation, THC is great for managing pain. So you might go to a 1-to-2 or 1-to-4, something like that, that can help you with pain that's really there. It's really important to figure out what the source of the pain is, because once you understand the source, like in my particular case, I have artificial knees and I have a herniated disc in my neck. If I can keep my inflammation down, I can keep my pain down. And that's really, really important. So that's one of the keys to being able to know which route to go and what's there. But again, feel free to talk to your to the dispensaries and also to your medical marijuana doctor. What they'll do is they will really help you quite a bit in figuring out the terpenes that you need. And then from that, the dispensary will help you translate those terpenes into products that will help you with your particular condition. And that's really, really key. I can't tell you the number of times I work with people who say that medical cannabis doesn't work. And when I take a look at the product they're using versus their condition, the product does not have a terpene profile that will help them with their particular condition. And once we make that adjustment to a terpene profile that helps them, magically, all of a sudden, cannabis works. So something to pay attention to. Let's jump into the next question, and that is that what happens to CBD during decarboxylation? Well, what's interesting, that's a very good question. And what's interesting is that when the plant is made, CBG is the first this cannabinoid that's produced, and CBGA morphs into THCA, CBDA, and CBCA, that when either heated or aged, that's what turns into CBD, THC, CBC, and CBG. Now, what's interesting, you asked me about decarboxylating CBD. When you decarboxylate, what you're really doing is you're heating the product. So you're taking a raw product. So when you buy flower from a dispensary, it is in a raw format. So there is really, technically, no THC, CBD, or CBD, CBC, or CBG in it. Right now, it's mainly THCA, CBC, CBDA, and CBCA. When you heat it, it then forms and turns it into CBD. So you're asking what happens to CBD? Well, CBDA turns into CBD, and the answer is what happens is CBD gets created. That's the bottom line of what's happening. Decarboxylation really allows you to be able to mature the product into a product with, again, the THC, CBD, CBC, and CBGs, and other components, other cannabinoids that really address your particular medical condition. And I typically do this when I decarboxylate. I make something called magic brownies, which I use when I want to sleep at night. I can take a brownie about an hour or two before I go to bed, and it helps me sleep the whole 8 to 10 hours that I'm looking for when I'm trying to get some sleep. So decarboxylation, to answer your question directly, decarboxylation produces or creates CBD. It doesn't modify it in any way, shape, or form. So I hope that answers your particular question. Other question that comes up is, how do I find a cannabis doctor? I do, let's see, and how do I go about explaining to my employer that you take medical marijuana when you do random tests? Well, there's a couple of questions that you lumped a couple of things into here. So let me first of all start by talking with your employer. It's important to sit down and find out what your employer's tolerance is for medical cannabis. It's interesting that a lot of companies that have zero drug tolerance policies, in many cases, do allow the use of medical cannabis. And the reason for that is because medical cannabis is something, it's not a drug. A drug is something that's manufactured in a lab. This is a plant that acts as a medicine, much like echinacea and a number of other natural remedies. And I know that especially in high-tech firms, I worked in high-tech for 38 years, and we had a lot of developers. And I can tell you, we never tested for cannabis because we knew the software developers were using it. Candidly, in Silicon Valley, if we tested for cannabis and expelled people who used it, we wouldn't have Google, we wouldn't have Microsoft, we wouldn't have Facebook, Twitter, all the rest of them, because that's just basically the genre or the practice of a lot of these software engineers. And it's not a negative, it's very much a positive. Now, on the other side of the coin, some companies are very strict. Some companies have a exception if you let them know. Some companies don't. I would sit down with your HR manager first, not your manager, your HR manager, and I'd ask them about your tolerance to medical cannabis. Get a reading. I wouldn't go to your boss first, because if they have a zero tolerance policy and you're going to talk to them about using medical cannabis, it could cost you your job. And of course, you want to have a heads up of that before you head into medical cannabis. And I don't recommend using cannabis if you have a zero tolerance policy company. I don't want to get you fired. That's not the objective of it. On the other side of the coin, I do want to make sure that you can be able to get your life back using this. So how do you go about explaining to your employer? Talk to your HR manager first, find out what their policy is. If their policy is, in fact, tolerant towards medical cannabis, then sit down and explain your medical condition to your boss and explain to them what you're going to do about that so that you can be able to manage it and basically be a good employee. That's what's really, really key. Now, how do you find a medical cannabis doctor? Well, there's a couple of different things you want to do. You can obviously go out to Google and say, find a doctor near me. I recommend MMTC of Florida as a way to go. And I know there's a lot of other companies that are out there. And the question becomes, why do I recommend them? And the answer is most of the doctors are doctors by themselves and they're practicing, and they'll get you a medical marijuana card. They're very straightforward with what they're doing. They'll do the diagnostics. Florida as a state requires the doctor to verify that you do in fact have that condition that qualifies for a medical card. So that's what the role of the doctor is. He's not there he's there to diagnose that you in fact have that particular condition that matches something that allows you to be put in the registry. He doesn't treat it. He's just showing you that he's just verifying to the state that it's there. Now, why MMTC? Because a lot of medical cannabis doctors will get you your card. I've had a number of people come to me and say, I've got my card. I paid $99 for it. I got it. And I called the doctor back and I don't know what to do. I got a card, but what do I use? How do I use it? Where do I go? The doctor basically says, I'm not going to handhold you. You got to do it on your own. And that's what typically happens. Doctors don't have the resources to have a support network to really help you. What MMTC does is they have a call network, they have a network, they have a call center you can call into with help with medical cannabis and also with the dosing. They also have nurse practitioners that are available to really answer your questions about medical cannabis to help you walk you through your process. And more importantly, they put together what they call a medical cannabis journey for new patients. So if you become a new patient, every 2 weeks after you become a patient, you'll get an email from MMTC that'll say the next 2 weeks you want to do this, you want to take a look at this, and they'll walk you through your journey the first 6 months, because this is really important. A lot of people are trying to figure out what it is, how do I use it, how do I have it address my particular condition, and that's where MMTC comes into place. So you can find a medical cannabis doctor again. You can either go to the office of the OMMU and you can look it up that way. You can do it on Google searches. I'm telling you, we go through all of it. What you're going to run into is a lot of doctors that are very well meaning. They know what they're doing. They're professionals, no question about it. But the question isn't that. The question is, what support do you get after you get a card? And that's really the important part about it. So once you find a medical cannabis doctor, you obviously schedule an appointment. You apply for a medical marijuana card, and that goes into the state OMMU registry, and you'll be able to have electronic verification of that. Actually, the day that you're verified by the doctor, So it means you can go to the dispensary and purchase product. And when you go to that dispensary, you have what they call the P number, and that P number is the number of your registry ID. And with that, you'll be able to pick up medical cannabis that's there. So I hope that answered that question. We had a number of questions of the employer, tests, doctors. So hopefully it answered a lot of those questions. Let's run into the next question that's there. What is the recommendation for fibromyalgia and sleep? Well, that's kind of an interesting broad range. Fibromyalgia is something that really it takes the sheath off your nerve and makes it, basically exposes your nerve. It's very, very painful. A lot of people that have fibromyalgia, if you just touch them, they have a problem. Now, the question becomes, how do you be able to repair or do something to be able to address that sheath? And that's where CBD comes into play. CBD does a great job of providing what they call a neuroprotectant capability, which means it goes out and it helps to coat those receptors and those nerves to be able to help them to help them be less sensitive to that condition. Now, does it cure fibromyalgia? The answer is no. What it does, it relieves the pain and can really bring the pain level down substantially in that particular area. So what's recommended is you look at the terpene charts. You have linalool, myrcene, terpinolene, germinal, and boronol. Now, those work not only for fibromyalgia. Interestingly enough, they also work for sleep. Now, here's the difference when you're looking at using it. If you're using fibromyalgia, you want to get instantaneous relief right away. So what you're looking for when you look at your routes of administration is something that gives you instantaneous relief. And what are those? Those are your topicals, right in here, almost immediately that's here. This is your inhalation products. This is your flower, your vapes, and things like that. They'll work really very quickly. In fact, the flower and topicals work usually within a minute or two. You can feel the relief right away. And in fibromyalgia, the right topical, cannabis topical, works very well. I don't have fibromyalgia, but I do have pain from herniated discs, and it works almost immediately whenever I have any problem with that particular area. So that's one thing you want to look at. But when you're looking at sleep, now you've got a route of administration that's completely different. What you want to do is you want to take the product, and then you want to go to sleep, and you want to stay asleep between 6 to 10 hours. That's what you're looking at. And so if you take something like a tincture, for example, or a spray, it'll work within 20 minutes, but it's only going to last 4 to 6 hours. So if I take it, let's say at 10 o'clock at night, I'm waking up at 2, 3 in the morning because the cannabis is worn off and I got the pain back. So you want to go something with a longer duration, and that's where you get into edibles over here. That's where you find the duration is anywhere between 4 to 10 hours. And that's what you want to play with. You want to play with your capsules and also with your sleep. I use, as I mentioned earlier, I make magic brownies. And my magic brownies will give me clearly 6 to 8 hours of sleep. I would love to get 10 hours of sleep, but unfortunately my schedule doesn't let me do that. But I do get a very, very sound sleep for at least 4 to 6 hours when I'm using medical cannabis, and sometimes 6 to 8 hours, which is really, really great. And so I'm trying to point out is that using a edible, using a capsule, so this could be gummies, this could be brownies, this could be cookies, this could be any of the lozenges and the little various candies that are out there. They're really good. They can really help you quite a bit. Now, here's what you need to be careful of. These edibles taste great. You try some of these, you try a little bit of a brownie or whatever, you're tempted to take more. Be careful, because if you take too much, then you're going to really get yourself into an area where you're starting to get a little heady and you're getting a little, getting stoned, to be candid with you. So start low and go slow. Start with like a quarter of the brownie. Try it one night, find out how that works. If you don't get a lot of relief, then go to a half a brownie and try that for a day or two. But go low and go slow, and that'll really help. That's there. And again, you want to look at a edible or a capsule that has the same terpene profile that we have located here. This terpene profile will help you with both of those conditions. But the question is, which one do I take for the duration and the onset time that I'm looking for, which is something Amy pointed out earlier. So I hope that answers that particular question. So the question becomes, next question is, when will PMHNPs and NPs, nurse practitioners, have permission to prescribe THC? Very good question. And the answer is, in certain states, like for example in Vermont, doctors do prescribe medical cannabis, not just THC, but they'll prescribe, just like they prescribe here for a pharma product. They'll tell you the type of product, how much to take, and that type of thing in that particular state. Now, here in the state of Florida and in many states, they don't, the doctors don't prescribe a product. Why they don't prescribe a product is because every person's body is different. And so what they would like you to do is choose a route of administration that makes sense, choose the terpene profile that addresses your particular condition, and then go low and go slow to your dosing process. Go through that and find out, like start with, you're using tinctures, you start with a quarter of an eyedropper for a day or two, then try a half an eyedropper and 3/4 of an eyedropper. What you'll do is you'll build up and you'll be able to find a place where you finally find your sweet spot, your therapeutic dosing level. If you go beyond that, you'll see it start feeling a little heady and you'll start feeling a little funny. Just back down to the previous version, and then you found your therapeutic dosing level. Now you asked the question of when they'll be able to prescribe it. That's a good question, because although you can prescribe, just like the doctors can say, take 2 pills and call me in the morning, what the doctor is really doing is giving you the minimum dosage, hoping that it works, and if it doesn't work, have you call back and ask for a new prescription. With medical cannabis, you don't have to call the doctor, you can make the adjustments yourself. But I suspect that right now, the politics is keeping people from allowing doctors to be able to prescribe cannabis. We need to finalize a lot more research in this particular area to give the doctors the information they need to do the prescription. And there's a lot of it that's out there. I'd just like to see a lot more for a lot more conditions, because they only handle a limited number of conditions. They only handle about 150 to 170 types of conditions, but we have over 400 different types of conditions that doctors address. So when will we have the capability to do that? Hopefully, when cannabis, first of all, gets rescheduled in this country, allowing research to be done, and more importantly, allowing us to bring research from other countries into this country to be able to be used. Right now, there's more medical cannabis research being done. This was done last year in 2025 than in all years put together. Where was it being done? Being done in Israel, being done in Canada, being done in England, being done in Germany, being done in Switzerland, and being done in South Africa. So there are actually programs in place. And by the way, Canada and Israel have a very active and a very aggressive program to really bring medical cannabis to the forefront. But we need more of it, and we need more to look at, because the medical conditions people can address are, I said, there's over 400 of them. We need to get more research being done so it helps the doctor be able to get very precise with respect to what he wants to do. The answer to your question is I don't know. This is based on politics. It's not based on science. If it was based on science, we'd be doing it today. Even though we have limited resources, we do know what really works for different conditions. So I hope that answers your question. I would like to have a better answer. I'd like to have a clearer picture of what cannabis is going to look like the next couple of years. But right now, the water is very muddy in that we have promises to reschedule, but we have no action taking place, meaning there's no meetings taking place with the various agencies that need to do the rescheduling. They've talked about it, but they've not put things in place. And so that's something we need to pay attention to. Next question is, why do dispensaries keep coming up with new strains? They have strains that work really well for my medical needs. Well, medical cannabis dispensaries are always looking for products that address a particular condition. Now, when you take a cannabinoid and you take a terpene and a flavonoid and you target something, for example, like sleep or like pain or like inflammation, when you put those combinations together, dispensaries are constantly working on these combinations, and they call those products cultivars. A cultivar is a strain that has purposely been made for a particular condition to address a patient's medical condition, I should say. Okay. So the answer is, why are they always coming with more of them? Because what you're going to probably see within 5 years is you'll walk into a dispensary and they'll say, here's a product for pain, here's a product for inflammation, here's a product for anxiety, here's a product for stress, here's a product for PTS. You're going to see different strain cultivars available to patients addressing those particular needs, because they have the terpenes, they have the cannabinoids, and they have the flavonoids that are really there. So why are they developing new products? To really focus on products that'll be able to address your particular condition. So that they're constantly developing products and looking at being able to do that. And I think there's another reason, and it's one that's important. Each of these strains are, the question is, what's in public domain and what's not in public domain. A lot of dispensaries make proprietary strains because they know that strain, for example, for pain, is very good and hopefully attracts more customers. Just like a person would go to buy an aspirin or an ibuprofen or something like that. Some of them work better than others, and that's why you use that particular brand. So it's branding, but the main reason is cultivars, but also branding is another reason that people do that. Next question is, can cannabis help with cervical stenosis, radiating nerve pain? What do I take? Well, first of all, you're talking about nerve pain. It's very similar in its diagnosis category as something like fibromyalgia. So what would I recommend? What I recommend is whenever you're looking at nerve pain, what you want to do is you want to do two things. You want to address the pain itself. And then the second thing you really want to do is you want to reduce the inflammation around that particular nerve, let's say, because if you can reduce the inflammation, it'll reduce the pain. I would recommend that you start low and go slow and start with a 1-to-1 type product. This is 1 CBD to 1 THC. Choose the route of administration that's comfortable for you, whether that's tinctures, whether it's edibles, oral, or what, and start in that particular area. Now, I also want to recommend that if you're looking at looking at flower, rather than smoking a joint, I recommend getting a dryer vaporizer. What that is rather than rolling a joint, because when you roll that joint and you put that 500-degree temperature up to that joint, you're burning off most of the terpenes, almost all the flavonoids, and a lot of the cannabinoids. By putting it into a dry vaporizer, which is a little device that you put the cannabis into a cartridge, you then turn it on and you actually set it to a particular temperature. What it's able to do is it's able to target that particular cannabinoid and that particular terpenes that you're looking for to really help you that's there. And when you say, what should I take? I would go the 1-to-1, go lean heavily on the CBD. Don't be afraid to use a higher ratio of CBD. And also, if you are looking at flower, I'd use a dryer vaporizer. I think that'll help you quite a bit. It'll make a big difference. Next question is, has cannabis been used to cure cancer? The answer is yes. And in fact, this is one of my pet peeves with the current situation here in the US. There is a doctor in Spain. Her name is Dr. Cristina Sanchez. Cannabis research was funded by the United States starting in 1964, and that money was given to Dr. Raphael Mechoulam in Israel because cannabis being illegal in the United States, no research could be done, but in Israel they could. And he not only founded research in the medical cannabis. He identified CBD, he identified THC, he identified the endocannabinoid system. There's a lot of work that was done, but part of that was one of his students was Dr. Cristina Sanchez. And 26 years ago, the country of Spain built her a lab in Spain to look at addressing cancer. And that's what she's been doing. She's put out over 800 papers just on cannabis and cancer. Where are they? They're in PubMed. The PubMed is the National Institute of Health's database for doctors and research. One of the criteria for getting funding from the United States is the research had to be put into PubMed, and there's 80,000 articles on how cannabis is used for various conditions, some of which are being used for cancer. Now, how does it work? Well, what Cristina Sanchez found out was that cancer is a very aggressive cell that takes more energy, basically eats more than a normal cell. When you use cannabis, what cannabis does, the neuroprotective capability, it coats your nerve endings, your cells, and what it does is it only allows the cancer cell to get the same amount of energy as a regular cell. And cancer cells need 5 to 20 times more energy than a normal cell. And what ends up happening is the cancer dies. There's actually YouTube videos by Dr. Cristina Sanchez showing that process happening. And there's also now research that's coming out of Australia showing that's working as well. So the answer is yes, it's been used. More research has to be done in this area. Clearly, cancer there's 100 different types of cancer. You have to really take a look at each one of them, really dig down on each one. But we do know that it is very, very effective being able to address cancer. Let me give you one last example of that. We had a president whose name was Jimmy Carter. Jimmy Carter was diagnosed with brain cancer. This was about 4 or 5 years ago. Magically, he was diagnosed with cancer. They gave him some medication, and he announced 2 months later that his brain cancer was gone. And he didn't die from brain cancer, by the way. What happened? They had a version of a product that was taken from Israel, brought into France, repackaged. It was a cannabis product that was given a pharma name, and that's what Jimmy Carter used. So the answer is yes, it does work and it's been effective. My mother, I put on medical cannabis 8 years ago when she was diagnosed with cancer, and the doctor wanted to operate and do chemo and radiation and all kinds of stuff 8 years ago, and my mother is still alive and kicking. She's like the Energizer Bunny right now. I do know it does work, and I'm willing to put my mother's life on the line to be able to do that. And I put my own life on the line to be able to use medical cannabis. But again, you got to understand medical cannabis and how it's used. Next question is, I have an 88-year-old mother with COPD. She has a loss of appetite and suffers from anxiety. Can this help? And the answer is yes. Cannabis works very well with COPD. It really is known to be able to help with that. But also, more importantly, what cannabis will do is it'll bring back some of your appetite and also reduces anxiety. What should she be taking? Again, go to a quality 1-to-1 ratio product. I'd go and I'd talk to your dispensary and tell the dispensary your mother has COPD and she wants to get back your anxiety and appetite. They'll actually have different products, and the different products that they're recommending really have a different terpene profile. Remember, we talked about the cultivars. They have different products or cultivars that address different situations, and the dispensaries will be able to direct you to that particular product that can help your mother quite a bit. And the answer is yes, very much so. My mother is now 97 years old. She was 88 when she was diagnosed with cancer. And like I mentioned, although she's 97 years old, has 97-year-old issues, she's still like the freaking Energizer Bunny. So we'll keep her, it's out there. The answer is this can help. The answer is yes, it can. And hopefully your dispensary, if not your medical cannabis doctor, can give you some guidelines as to what to use. So let's take a look at, do we have any live questions tonight? Do we have any live questions? Yes, we have two. Treatment for trauma and CPTSD, ADHD, and any thoughts? The answer is yes. When you have trauma and PTS, this is something that I've worked with. Not only I've worked with some veterans, but I've worked with, believe it or not, a lot of people that are not veterans. These are just ladies that have had a horrific, been attacked. We've had people that have had auto accidents. We've had people that have had deaths in the family. All those can bring on PTS and also can bring on trauma. And the answer is medical cannabis can help with all of that. And what you really want to do is you want to pay attention to products that have myrcene in it, beta-caryophyllene in it, and also you want to have something like limonene in there as well. So those are the terpenes that you're looking for. And again, talk to your medical cannabis dispensary. They'll tell you which products. And again, it depends on which products that you want to use. But I would not shy away from using these products, again, for trauma or PTS. I have one person that I work with in the industry. She's not in the industry anymore, but she was a representative for a dispensary who had a terrible trauma situation. And she's been able to not only use medical cannabis to recover from that, she now has 5 wonderful children, and she's living a very, very effective life. Now, it doesn't mean that everything's 100% hunky-dory, but it does mean that she's about 80 or 90% of the way back, which is really a longer way back than she ever thought she would ever be. So the answer is yes, it does work, and I've seen it work in a number of different cases. Other question is cannabinoid receptors in the body. Well, right now they've identified about 200 of them. There is a chart, which we'll send you as a follow-up to this webinar, that has, it's like a periodic chart of not only cannabinoids, but also of terpenes and also of flavonoids. Now, what's important is there are identified today approximately 200 different cannabinoids, and that ties to various receptors that are within our body. Now, the main receptors you hear about are CB1, and you hear about CB2 receptors. However, if you noticed in the webinar, we showed some receptors like GRP55 and A2A that really address different situations. One addresses pain and inflammation. One will address pain, inflammation. One will address sleep, for example. The various sleep receptors are clearly something that cannabis addresses. Think of receptors like Legos, and they all have different shapes. And when you have a cannabinoid, what it does is it looks at a receptor and really locks on to that shape of that receptor. And that's why certain cannabinoids work better with certain receptors than others, because they have that just like a Lego, it has that locking mechanism that locks into place. Once the cannabinoid locks into place with the receptor, it opens up that receptor so the terpenes and the flavonoids can be deposited to do their medical magic. So that's really there. But yes, there are again, 200 different cannabinoids. Right now, there are, just to be identified, we have identified approximately, last time I saw my medical research was about a month and a half ago, they identified right now about 85 different receptors that in your body that are favorable towards cannabis. And there could be more. Again, this all has to do with this research that has to be done to be able to pull up information and be able to find out that's really out there. We have, the human body is a wonderful, wonderful tool. Cannabis is probably the most medically effective and efficient plant that's out there. And really being able to do research between the two is going to do nothing but help us be able to not only get better, but also stay healthier. And that's something that hopefully people can pay attention to. So I hope that hopefully answers that question. Lee, we have any other questions? We don't. Okay, well, great. Well, first of all, I want to thank each and every one of you for joining us tonight. I know this has been a lot of information. It's taken a while to go through it, but hopefully it'll help you be able to get your life back and identify the processes that are important to be able to come up with a product, find a cultivar and a route of administration that addresses your particular condition. I do want to, first of all, want to not only thank you, but I want to thank our in the background, we have some moderators that are doing a great job of not only helping to produce this, but also manage the background. That's Lee and Leah. I want to thank them for their work as well. But I also want to mention that if you were looking for a medical cannabis card, I recommend the medical marijuana treatment clinics of Florida. I think we talked about that earlier. They do a great job of supporting you. It's not a matter of getting your card. It's a matter of what you do once you get your card. How do you make sure that you can then turn that into something that addresses your condition? And naturally, I'd like to, first of all, point out and thank Air Cannabis Dispensaries. They're sponsors of this, and they do a great job. They have I think, 35 different dispensaries here in Florida. They have a very well-trained staff. They have a quality product that's being really put out there. The COAs will show you that there's clean products, no pesticides, no molds, quality products, great terpenes. That's something that you really want to pay attention to. So I recommend Air Dispensaries as a place to go to get your product. And again, last but not least, let's talk about patient education. Webinars like you're watching tonight from Marijuana Aware are very important. We have new webinars coming up. We're having one next week on medibles or on edibles next week. And then also we have terpene toolbox. And then we dive into dosing, arthritis, also neuropathy. And then in March, we're doing a weight loss webinar. So please feel free to join us. And more importantly, check out our YouTube channel, marijuanaaware.com. That's YouTube/marijuanaaware.com. It's got a wealth of information, not only about this particular topic, but about just cannabis in general. I think there's over 80 different videos that are out there that address a number of different conditions, and we're producing them literally on a daily basis, and a lot of different reels that you'll find on YouTube. So I hope that helps you quite a bit. First of all, thank you very much for joining us, and look forward to having you join us next